Prevention and treatment. Prevention. There is currently no vaccine to prevent 2019 nCoV infection. The best way to prevent infection is to avoid being exposed to this virus. However, as a reminder, CDC always recommends everyday preventive actions to help prevent the spread of respiratory viruses, including avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Stay home when you are sick. Clean and disinfect frequently touched objects and surfaces. These are everyday habits that can help prevent the spread of several viruses. Treatment. There is no specific antiviral treatment recommended for 2019 nCoV infection. People infected with 2019 nCoV should receive supportive care to help relieve symptoms. For severe cases, treatment should include care to support vital organ functions. People who think they may have been exposed to 2019 nCoV should contact your healthcare provider immediately. Cook meat and eggs thoroughly to reduce the risk of infection. Coronaviruses can transmit from animals to humans, so it's important to cook animal products thoroughly to kill any germs. 10. Follow the instructions for the type of meat or eggs you're cooking, and check the internal temperature of your food using a food thermometer before you eat. Limit your contact with live animals to lower the risk of transmission. Don't risk handling an animal that might be ill. Avoid handling live animals unless you work with animals or are caring for pets. If you must handle an animal other than your pet, touch it as little as possible. Farm animals and bats are the most likely sources of infection. Wash your hands immediately after handling live animals if you must. You don't want germs from the animals to linger on your skin. Wet your hands and apply a mild soap. Lather the soap on your hands for 30 seconds, then rinse it off with warm water. Dry your hands on a clean, dry towel. If you're handling multiple animals, wash your hands between animals in case one animal is ill. This way you won't accidentally infect the other animals. Contact your doctor if you suspect you have coronavirus. If you have symptoms of a respiratory infection, you might have coronavirus. Call your doctor to tell them about your symptoms and ask if you need to come in for an exam. Your doctor may ask you to come in for lab testing but could recommend you stay home to avoid spreading the infection. Watch for the following symptoms. 16. Cough, sore throat, runny nose, fever, headache, body aches and fatigue. If you go into your doctor's office, be sure to wear a face mask to prevent spreading the infection to those with weakened immune systems. Stay home if you have symptoms of a respiratory infection. Aside from going to the doctor, don't leave your home if you're sick. You may be contagious and don't want to spread the virus to anyone else. Focus on resting and giving your body time to recover. If you go to the doctor, wear a disposable face mask if you have one. This will prevent germs from spreading. Cover your mouth and nose when you sneeze or cough. You'll likely cough and sneeze a lot if you have coronavirus. Protect others from your germs by covering your mouth with a tissue or your sleeve. This will prevent your germs from becoming airborne. Try to keep a box of tissues near you at all times. However, it's also okay to sneeze into your bent elbow if you don't have a tissue.